Hello friends, welcome to UK Dreamers. I'm Dr. Aman, and in today's video I'll be discussing about how to answer the ethical scenarios asked during interview questions, be it for a non-training job, be it for a training job. It's equivalent for all SHOs, registrars, everyone who's going to appear for the interviews. So as you're aware, whenever you would go for interviews, you would be asked questions about different categories, like for instance a biographical question about yourself, your journey and all, a clinical scenario, ethical scenario, what about your future aspirations, a little bit about NHS governance and how the NHS works. So most of us as foreign graduates, we would get stuck in the ethical scenario because we have not been acquainted to the system, how the medical ethics work here in the UK. So for you to understand it, I will give you a brief summary. What are the ethical backgrounds, or what are the ethical pillars of medical ethics that you need to get acquainted, how to approach the scenario, and I'll end up giving you examples so that the understanding is better for you guys. So if you've not subscribed to the channel, guys, please go hit on the bell icon, see my videos, share it with your friends. I'm also on Insta, Facebook and LinkedIn, so just follow me, guys. It supports me a lot, it encourages me. So first of all, so ethical scenario, as you're aware, the NHS is a different system, so the medical ethics would be different. So for you to understand them, there's a basic way how you can approach these patients and keep a mind that you're not missing anything. So the basic abbreviation or the mnemonic that I've made is called no jab. No stands for no maleficence. The patient should not come to any harm. If they've come to any harm, make a note of what the harm was and what are the complex scenarios that the interviewers are expecting you to handle. So no means no maleficence, J means justice. So if the patient has gone to some harm, if there has been some unforeseen circumstances and unavoidable outcomes, you need to make sure that the patient gets justice to it. A stands for autonomy. Every patient is different, guys. So what is right for patient A doesn't necessarily mean it's going to be right for patient B. So it doesn't imply to everyone. Every patient is different. Every patient has different situations. So approach the patient as an individual, not as a group. And B stands for beneficence. So make sure that the patient is getting the good medical benefit that he's come to you for. So once you've made sure that you are following this pathway, whenever you'd be asked about a clinical scenario, use this and try to make an idea in your brain before you start to speak to the examiners. So guys, whenever you are being asked about the question, you need to think about a framework. So basically you need to follow another mnemonic of mine, which is called A, B, C, D, E. So guys, whenever you are being asked about the question, you need to think about a framework. So basically you need to follow another mnemonic of mine, which is called A, B, C, D, E. A stands for attention. So you need to make sure what is being asked of you, because ethical scenarios or dilemmas are basically trying to test how you work in pressure, how you work with difficult conditions in difficult scenarios. So you need to make sure that you need to follow a certain pathway on this so that you get the maximum marks and maximum yielding from the scenario. So as I said, you need to follow A, B, C, D, E. A stands for attention. So attention to the clinical scenario that is being asked of you. So you might get misguided or confused hearing the scenario. Make sure you're hearing what's the end point of it, basically what do the examiners or the interviewers are expecting you to say. So attention. B stands building a framework. So as I said, I gave you a mnemonic earlier, no jab. So you need to make sure that you follow no jab. You can, while answering the scenario, you would have to change the scenario a little bit. So the no jab that I told you, you have to rearrange it, because you need to go with the autonomy, you need to go with beneficence, you need to go with no maleficence, and you need to go with justice. So it's entirely up to you how you memorize it, but the no jab is basically for you to memorize it well. C stands for contemplating a chain work. Chain as in, so the patient has the patient's relative, your colleagues, and the entire system. So you need to make sure that you're aware of all the chains, of all the complexities revolving the patient's relative, your colleagues, and the system as a whole. D is for you to discuss how would you actually go about this clinical scenario. So you need to discuss about what your plans are, how would you have negotiated, how would you have reacted, what would you have done for the beneficence, and hence and so forth. And the last one is E, explanation. So you've made a decision, you've described whatever you wanted, now you have to explain. The reason for explaining is how have you justified yourself. So all of these would be utilized when you would eventually answer a scenario. So let's go ahead with a scenario. You have a 19-year-old patient who's got cerebral palsy, epilepsy, who's coming in with difficulty in swallowing, and you have a preliminary diagnosis of aspiration pneumonia. And this is a Friday afternoon. So the plan is for the patient to go get a salt assessment, swallowing assessment, and till then the patient is kept nil by mouth, but we also put a nasogastric tube in so that the medications, some food and stuff can be given to the patient. So Friday evening the tube is placed in, okay, but the tube's placement could not be confirmed. So now this patient missed getting his anti-epileptics for the next 2 days. Monday morning he gets a seizure and ends up going into the critical care unit for further management. So now the relatives are waiting because they came to meet the patient in the ward, and then all of this circumstances happen. So how would you approach this scenario? So I hope you've heard the scenario that I just talked about. So the way to go for this scenario is A, B, C, D, E. A, attention. Did you pay attention to what was being, dragged into the scenario? So what happened? What led to the patient coming to the hospital? What led to the complications? And what's the current status now? So this is what you need to pay attention to. B, build the framework. As I said, no jab. But unfortunately, the patient did come to harm. The patient has ended up going into critical care. So definitely there are few things that you would need to be addressing them. C, contemplating chain of events. So you must be knowing what led, as I said, what led to the patient coming to the hospital. So you need to know about the patient. You also need to know about the patient's relative, okay? And you also need to know about the colleagues, basically our system, okay? The D, you need to discuss. So in such scenarios where there has been some harm to the patient, something has been missed and the patient has eventually become poorly or has ended up getting some harm in some or the other form, you need to do something which the interviewers would love to hear, and it's called duty of candor. So basically you need to be truthful, you need to arrange things in a way that you have to describe this to the next of kin or to the patients themselves, and be truthful. Tell them what happened, what were the mistakes, and hence and so forth. And in the end you need to basically explain the things that you've discussed. So yes, you've done the duty of candor, you've done the explaining, you've explained, you've apologized, whatever, but in the end, the things that need to close the loop, basically, you need to talk about something which is called RCA. That's a root cause analysis for this. So for this, after all of this has happened, you would discuss this, escalate this to your registrars, to your consultants, to your safety leads, hence and so forth. And you would also do something which is called DATEX. Read about DATEX. I'll make a video about that as well. So once you have done all of this, then and then only your ethical scenario is complete. So let's answer this scenario in this possible way. So, if there's a relative waiting in the waiting hall, so I would go, I would usually try to take a nursing colleague with me or some medical senior if you're not confident enough. So now I'm in the room and here's what I'm going to do with the scenario. Good evening, sir. My name is Dr. Sharma. I'm one of the junior doctors here in the ward. This is my colleague, Miss X, and we want to discuss something about your son, what has happened this morning. So as you're aware that he was brought in with some swallowing problems, he was diagnosed to have a lung infection, and apparently his swallowing was not very good. Thus, we had planned for him to get assessed by the swallowing team. Meanwhile, we had put a tube through his throat so that we could have given him the food and the medications. However, the tube was not deemed safe. Thus, we could not get him his medications, and unfortunately he had a seizure this morning, and that's the reason we had to transfer him to the critical care for further management. He's stable at the moment. He's being taken care by a critical care team, but unfortunately, yes, this has happened while he was in the hospital with us, and I apologize on the behalf of my colleagues and my team that there was a delay in getting the medications because the tube couldn't be deemed safe for further use. I understand this is very upsetting and frustrating for you, but please take my deepest sympathies, and we'll try everything to make sure that your son is being taken care of, and to make sure that we try to improvise things and take a learning from this. If you have any other further questions, you can ask me now. And we'll try to update you regarding his current status, whenever we can. Thank you. So so what basically happened, as you could see, I tried to bring the attention of whatever scenarios happened. I tried to build up a framework telling, that the harm had been done, of course, and when I talk about the harm, I also told about that we'll try to keep things better. I did try things explaining to them with slight compassion and empathy, tried to listen to their concerns and questions basically. And then I followed the chronology events, the chain basically. So I talked about the patient, I talked with the relatives a little bit about them, and I also did talk about my colleagues that unfortunately the tube could not be placed, and hence and so forth. And then I did discuss about what's going to happen next. And at the end, so once you've come out, you need to make sure that you tell your examiners that you discussed this with the relatives and this is what happened and this not. And you would also try to escalate this and discuss this with your seniors and make sure that it is well documented. And if RCA needs to be done, the RCA would go ahead. You would, the seniors would do it. If you want to, be participating in it, great. And you need to talk about DATEX. If you tell the word DATEX, they would be more than happy, because it takes care of governance, it takes care of the ethical, closing the loop basically. So this is the way you should be answering an ethical scenario. I know there are tons and tons of ethical scenarios: wrong medication, wrong patient, wrong information, data breach, safety breach, confidentiality breach, and whatnot, guys. So we all are humans and we would make mistakes. The best part is go them in this way, both in your clinical way, the practice you would be working at some point, and also regarding to the interviews. So I hope this was informative for you guys. I would keep posting such ethical scenarios for a couple of weeks. Guys, I'm getting a lots of emails regarding, people asking me my phone number and, asking for a one-to-one session. So I'm actually thinking of starting a one-to-one session, but unfortunately, guys, it has to come with some bare minimum. So I'm not ripping anyone off. It has just to be a form of commitment from your end, because it has happened to me that I've given time to people and they didn't show up. So, I end up wasting my personal time in that way. So if you've not subscribed, as I said, guys, please subscribe it, share it with your friends. It gives me a lot of inspiration, because even my schedule is getting tighter every day. So till then, I'll keep seeing you in the videos and in the comments basically, and yeah, I'll keep making such more videos, and your job is to share and subscribe, guys. Thank you so much. Cheers. Bye.